Hello, I would like to talk about a problem which is not very often talked, that is sexual dysfunction in diabetics. In men, it is erectile dysfunction, and in women, it is vaginal dryness and recurrent infections in the genital tract. Erectile dysfunction is quite a common problem, but it is not very often talked about. In diabetics, the primary reason is autonomic neuropathy. That is, diabetes affecting the nerves and the autonomic nerves. Autonomic nerves are the nerves which control the function of the visceral organs, like the heart, the digestive system, the genitourinary system, etc. So once diabetes affects the autonomic nervous system, there is erectile dysfunction, there is inadequate erection, so many other problems. There are some other contributory factors like smoking and alcohol. As is often said about alcohol, it increases the desire but takes away the performance. So definitely alcohol is not a solution to any of the sexual problems. Similarly, there are recurrent genital infections which happen with diabetic women and men. And sometimes we see that there is a genital infection which happens in men, and that brings an attention to a person being diabetic. On top of this, there are other issues like low testosterone. Some people undergoing prostate surgery encounter a sexual dysfunction. Similarly, there are some drugs which are used for hypertension. Then there are some neurological and spinal problems which may also result in sexual dysfunction. So, and if you take the sexual dysfunction in women, it is not at all talked about. First of all, it is abstract and it is culturally considered not nice to talk about it. So, the first and foremost thing is to talk about it. Sometimes there is a psychological overlay to this problem, and we often see that men have an immense pressure to perform, and they think it is their duty or they should take the lead in the sexual act. So this also puts them under high pressure. So if we look at the remedies, first and foremost is a perfect diabetic control. Avoid neuropathies, peripheral neuropathy as well as autonomic neuropathy, and talk about the problem so that you get a scientific solution to the problem. Never take an over-the-counter drug. Always either consult your treating physician, a neurologist or a urologist for that matter, and then take a properly prescribed drug for erectile dysfunction. Recurrent genital infections should be well controlled. If required, psychological support and cognitive therapy should be given, and some of the drugs, like some of the antihypertensives, may need to be changed in order to circumvent this problem. So the solution to the problem begins with talking about the problem and an excellent diabetic control. Thank you.